Good morning, friends. I am Dr. Ashish Sabharwal, Urologist, Andrologist and Robotic Surgeon from New Delhi, India. In this video, I will show you an interview of a patient who has come from Canada. He was suffering from erectile dysfunction and then he has come to us for penile implant surgery. He is a 41-year-old patient and he was suffering from erectile dysfunction, and we have done a Rigicon Rigi10 penile implant on him. And now we will talk to him and ask him about his full experience, and let us see what he tells us about his whole experience.
Hi, as the doctor explained in his video that I am from Canada. I was suffering from erectile dysfunction for many years. So in Canada, the medical system is governed by the government. So you need a referral to go to the urologist. So I was first of all following up with my family doctor, who just put me onto the pills like Viagra, and I had, apart from erectile dysfunction, I had premature ejaculation as well. So he was treating me with antidepressant. So it didn't help me at all. He then finally referred me to the urologist. Urologist also did the same thing, like he just gave me the medicines. Like nobody was taking me seriously over there. And having an erectile dysfunction, it's on your mind, right? It affects your life in all aspects. You cannot focus or live a quality life. So after doing a research, I was doing a lot of research about how should I get rid of it, and that is how I found Dr. Ashish Sabharwal's video about the penile implant, how in-depth knowledge does he provide. And then I decided to contact him in September. We had a long chat for about 2-3 months. And then I am basically born and brought up in India, so I know few parts of India, but still, like, I never been to the Delhi. So I asked him, like, this is my first visit to Delhi, and how would you accommodate me? So he arranged for a airport transportation from his side, and then we just came, met, decided. So on the date, first I did a circumcision on March 7th, and after a couple of days I did the penile implant. It was Rigicon 10. My overall experience is excellent. I got very good treatment from Dr. Ashish. And apart from the treatment, I think what I found is that you ask him anything, and let it be in person or let it be on the WhatsApp, and he's always available. Like erectile dysfunction, premature ejaculation was two issues, but apart from that, I always had low testosterone, so we have tested that too. And he wasn't hesitant to even provide me treatment for that. Like, he was not like, you came for implant and why should we talk about the other problems, right? So he helped me with that. Now I had an injection. His hospital staff was awesome, like in the OT as well as in the hospital. Apart from that, he arranged me for the hotel stay as well. The hotel was very nice. What I would recommend for the people who are living abroad and who are facing problem like me, and especially who are not able to reach to their urologist, they should contact Dr. Ashish. Basically, have a talk to him. I am 100% sure you will get all your questions answered, and you can go from there. I think that's what I would like to say. I'm very much thankful to him. In the morning, I said the same thing to him. I think there are many more patients in the world and across different parts of world who are suffering from the ED, but they are not able to get the right services. I think it's easy here. You come, you talk to him, plan your dates, and get the surgery done. It was an easy experience. It was a hassle-free, easy experience for me. I think that's what I could say at this point of time. Thank you so much, Dr. Ashish.
Thank you. So yeah, he mentioned that first he had circumcision, and also after 2 days we did the implant. When he came, there was infection in the foreskin and a little bit pus was also coming out. So we decided not to do the circumcision and the implant at the same time. Normally we do both the things at the same time, but because of the infection, we first wanted to treat the infection. And when the infection was treated, so when we did the ZSR circumcision, within 1 day, when he came next day for dressing, all the pus was gone. Is that correct?
Yeah, that's right.
So that was a very good, quick recovery, because when I saw him first, I said, I don't know, in 3 or 4 days we'll do it.
Yeah.
But in true. 1 or 2 days only, the whole infection went off, and then after that we did the implant. And right now he's about 5 or 7 days post surgery.
Yes. So today is I think 13th, and my surgery was done on 9th. So it's about 4 days.
4 days.
Yeah.
So how is the pain right now?
There is no pain. Initially, 1 or 2 days I had a bit of a discomfort, but now it's all gone.
Okay.
And I'm feeling much more healthy, better, mentally, physically, both ways.
Okay, and how do you feel the overall rigidity of the implant? Do you feel it is good?
It is good, especially Rigicon. I think the reason I didn't go for the Indian one because of the bendability issue. I worked in an office setting, so my concern was that I need little bit of bendability. So I find now I'm wearing my you could see a track pant, and you could like my length is about 5.25, but even with the rigidity and with the bendability, you can't even notice that I have an implant.
Yeah, so that's very nice. And we had measured his length before surgery. That was about 5.25 inches, and even after the surgery the length is same 5.25 inches. So I want to tell you that with implant we do the maximum sizing, and maximum sizing means that we do artificial erection, and whatever is the maximum size which is possible for you, you will get it after implant. But implant is mainly for erectile dysfunction treatment. It is not something which is done to increase the length of the penis. So if you are having no erectile dysfunction and you just want to increase the size of the penis, then implant is not an option for you. So I just want to tell you that he had a good experience. He had come all the way from Canada.
Yes.
And the reason why I made this video is because he said that many patients are having this problem in Canada, and they should also get awareness so that they can come to India and get the treatment. And I thank him for giving this interview. And if you also have any query about erectile dysfunction treatment or penile implant surgery, you can contact me by email or WhatsApp. My email address and WhatsApp number are given in the description. Thank you.